Welcome to our in-depth look at the stent placement procedure, a vital intervention for maintaining heart health. Before we dive into the procedure, let's understand what stents are and why they are so crucial in modern cardiology. A stent is a tiny, expandable mesh tube inserted into an artery to keep it open, especially after plaque buildup has narrowed it. Stents are primarily used to treat narrowed or blocked arteries, common in conditions like coronary artery disease, which can cause chest pain or heart attacks. Proper preparation is key to a successful stent placement. Let's look at what that entails. First, the medical team conducts a thorough assessment, including reviewing medical history, performing physical exams, and running necessary tests to ensure the patient is ready. The patient is given local anesthesia at the access site, typically the groin or wrist, and the area is sterilized. A small incision is made, and a catheter, a thin, flexible tube, is carefully inserted into an artery. Through this catheter, a guiding wire is advanced into the artery, serving as a pathway for subsequent instruments. Using X-ray guidance, the catheter and guiding wire are meticulously navigated through the arterial system until they reach the site of the blocked artery. The next critical step is balloon angioplasty, which opens up the narrowed artery. A balloon-tipped catheter is threaded over the guiding wire to the blockage. The balloon is then inflated, compressing the plaque against the artery walls and widening the artery. This inflation restores proper blood flow, alleviating symptoms and preventing further damage to the heart. Now, let's look at how the stent itself is delivered and deployed to maintain the opened artery. The stent is typically crimped onto another balloon catheter. This ensures precise delivery to the target area. Once positioned, the balloon is inflated, expanding the stent and pressing it firmly against the artery walls. The balloon is then deflated and removed, leaving the stent in place. After the stent is successfully placed, post-procedure care is crucial for recovery and long-term success. The catheter is carefully removed from the access site, and pressure is applied to prevent bleeding. The small incision is then closed. Patients are monitored closely for several hours or days in the hospital to ensure there are no complications and that the stent is functioning correctly. Patients are usually prescribed antiplatelet medications to prevent blood clots on the stent and scheduled for follow-up appointments to track their recovery.